Welcome to Mihiraa's English Listening Test for Healthcare Professionals. Sample Test Part A1. Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a physician talking to a patient called Mihiraa. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mihiraa, please be seated. Tell me, what is bothering you?
Doctor, I'd like to request a re-evaluation for the potential diagnosis of idiopathic normal pressure hydrocephalus.
All right, how old are you currently?
I am 80 years old, doctor.
Mihiraa, could you please share when and how you developed this illness?
Well, it all began a year ago. I found myself struggling with severe cognitive decline, difficulty in walking, and incontinence. In fact, I was admitted to the hospital, and they tried draining cerebrospinal fluid through a temporary spinal catheter, but unfortunately, there was no significant improvement from that treatment.
Your MRI reveals that you had cervical stenosis. Mihiraa, it appears that you underwent a cervical laminectomy and instrumented fusion 6 months ago.
Indeed, there has been a lack of substantial improvement. In fact, I believe my condition has deteriorated compared to how I was a year ago. In practical terms, I've reached a point where walking unaided is virtually impossible. I rely on both a walker and the assistance of a caregiver to facilitate any walking or standing.
Are you experiencing any headaches?
No, doctor. I believe my memory has deteriorated further.
Which medications are you currently on?
In the evening, I take RISP at a dosage of 10 mg. Carbidopa 25 mg or levodopa 100 mg 3 times a day, citalopram 40 mg daily, finasteride 5 mg once a day, Flomax 0.4 mg once a day, a multivitamin with iron once a day, omeprazole 20 mg once a day.
Mihiraa, your cranial nerve exam shows no upward gaze today. Downward and horizontal gaze is intact, but your gait is severely debilitated.
I see.
I've reviewed your CT scan of your brain and compared it to the MRI scan from 8 months ago. Now, Mihiraa, I can see that the ventricles appear larger. The anterior entirety span had initially measured around 5.5 centimeters, but presently, it extends to 6 centimeters. Simultaneously, the third ventricular span registers at 15 millimeters in its current state.
What does that mean, doctor?
It leads me to the conclusion that you have idiopathic normal pressure hydrocephalus. There's also a possibility of supranuclear palsy, incontinence, and urinary urgency. Although you had a CSF drainage via spinal catheter a year ago, Mihiraa, I strongly recommend that you repeat this procedure now due to the further enlargement of the ventricles on the scan. Additionally, I would recommend a shunt surgery, which could potentially make a significant difference in your condition.
Thank you for explaining, doctor.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Mihiraa. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Greetings, doctor, and good morning.
Good morning, Mihiraa. What seems to be bothering you today?
I've been experiencing quite a concerning issue, doctor. Over the past 3 months, I've been grappling with persistent headaches, and they've become increasingly severe. What's particularly distressing is the fact that I've also been encountering pulsations in my head almost on a daily basis. These pulsations seem to synchronize with my heartbeat, as I can distinctly hear my heartbeats in my head. It's been a consistent and bothersome problem that has been affecting my daily life and overall well-being.
Mihiraa, precisely where in your head are you experiencing pain?
I feel the pain on the crown of my head.
Oh, I see. Have you had any prior instances of headaches? When did this issue actually begin, Mihiraa?
In fact, the pulsations in my ear started shortly after I had taken a flight to visit my hometown.
Did you notice any drop in hearing or any changes in your ability to hear?
No, doctor, but I have experienced episodes of dizziness in the past, accompanied by nausea and occasional imbalance. Additionally, I've noticed unusual sounds in my left ear when I speak on the phone. The pulsating sounds are isolated to my left ear.
All right, Mihiraa. Have you noticed any alterations in your vision?
No, doctor.
Well, do you engage in smoking or alcohol consumption?
I don't drink alcohol, but I used to smoke a pack a day, and now I have completely quit smoking.
By the way, Mihiraa, have you experienced any prior illnesses or undergone any surgical procedures?
I've had skin cancer treated on my arm and back. Additionally, I've undergone various medical procedures, including a left nephrectomy as a kidney donor, C-sections, mastectomy, laparoscopy, and treatment for temporal orchitis.
Could you please provide a list of the medications you are currently taking?
I am currently taking Tylenol and Excedrin, as well as a multivitamin and probiotic.
Do you have any allergies to medications?
Yes, I have hypersensitivities to codeine and penicillin.
Mihiraa, your cardiovascular test shows a regular heart rate and rhythm with no murmur detected. Notably, there is an old mastoidectomy scar present on your left ear. Well, Mihiraa, your Weber exam shows a midline result, and your hearing appears intact. However, you are experiencing pulsatile tinnitus in your left ear, which is attributed to a disorder at station 2. Additionally, there is a potential diagnosis of normal pressure hydrocephalus, a deviated nasal septum, and dizziness, which may be linked to Meniere's disease. Mihiraa, to address these concerns, I am ordering a carotid ultrasound study as part of your evaluation, as your condition may be related to your eustachian tube. That is the end of Part A.
Now, look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now, look at question 25. You hear a physician explaining the issues involved in treating lower back pain. Now, read the question.
Lower back pain poses a critical challenge in healthcare, especially as it rises alongside an aging population. This issue is exacerbated in low and middle-income countries where resources are limited, intensifying its impact. Notably, most cases lack specific spinal abnormalities, emphasizing the need for global action. Clinical guidelines advise a biopsychosocial approach, prioritizing non-pharmacological treatments like self-management and exercises. However, these guidelines primarily stem from high-income countries, creating a gap between evidence and practice. Current approaches often involve unnecessary procedures, neglecting recommended treatments. To address back-related disability, interventions should align with evidence, emphasizing activity recommendations. While promising solutions exist, intensive research is crucial for broader implementation. This includes redesigning clinical pathways, adopting best practices, and integrating health and occupational interventions to prevent disability effectively.
Question 26. You hear a conversation discussing melasma and various forms of this skin condition. Now read the question.
Hi, doctor. Can you provide information about melasma and its different types?
Certainly. Melasma is a common occurrence of patchy brown, tan, or blue-gray discoloration on the facial skin often observed in women during their reproductive years. Typically, it manifests on the upper lips, upper cheeks, forehead, and chin of women aged 20 to 50. Melasma presents in 4 distinct pigmentation patterns: epidermal, dermal, mixed, and an unnamed type specific to dark-complexioned individuals. The epidermal type is characterized by excess melanin in the skin's superficial layers. Dermal melasma involves melanophages dispersed throughout the dermis. The mixed type combines characteristics of both dermal and epidermal melasma. The 4th type is marked by an excess of melanocytes in the skin of individuals with dark complexions.
Question 27. You hear a conversation between 2 doctors discussing VX and its impact. Now read the question.
Hi, doctor. Could you provide information about VX and its source?
VX is a synthetic chemical warfare agent categorized as a nerve agent, known for being the most toxic and rapidly acting among all recognized chemical warfare agents. It bears similarities to organophosphate pesticides. Symptoms of exposure to the vapor form of VX can manifest within a few seconds, while the onset of symptoms from exposure to the liquid form may range from a few minutes to 18 hours. In comparison to the nerve agent sarin, VX is considerably more toxic through skin contact and inhalation. Due to its low volatility and slow evaporation from liquid to vapor, VX poses both a long-term and short-term threat.
Question 28. You hear a nurse in the emergency department discussing the patient's care with a doctor. Now read the question.
So, who do we have here?
This is Marcus White. He came in with a dislocated shoulder. Given his Marfan syndrome, we've dealt with this issue before. Last time, his shoulder popped back in as we were placing his arm in a sling, and he managed to reset it himself by relaxing his muscles. However, he's in significant pain now, struggling to relax those muscles and bring them down.
I understand. Should we start with some nitrous and pain relief?
Yes, I believe that's the best approach until he can relax a bit.
Question 29. You hear a conversation between a doctor and a nurse discussing the origin of glioma. Now read the question.
Hello, doctor. Can you provide information about glioma and its exact cause?
Gliomas are categorized into different types based on the specific cells involved. Ependymer tumors arise from cells in the appendix or brain ventricles and spinal cord. Oligodendrogliomas involve oligodendrocytes, which provide myelin insulation. Astrocytoma tumors affect astrocytes, responsible for nutrient transport and structural support to neurons. The exact origin of glioma is yet to be defined, although certain hereditary disorders are known to elevate the risk of developing these tumors. Examples include tuberous sclerosis and neurofibromatosis. There are also mixed gliomas, which contain a combination of cell types, such as oligoastrocytoma, for instance.
Question 30. You hear a doctor providing an explanation to his nurse regarding functional gastrointestinal disorders. Now read the question. Doctor, could you provide an explanation about functional gastrointestinal disorders in patients?
Certainly. Functional gastrointestinal disorders are a common occurrence in my daily clinical practice. They are characterized by challenges in motility patterns and visceral hypersensitivity. It's crucial to address bloating and gas issues early on to prevent the condition from advancing. Minor symptoms include bloating after meals, loose stool, constipation, and gas, while major symptoms encompass acid reflux, foul-smelling gas, and abdominal distension. Severe symptoms of the disease include foul-smelling sticky stool, hematochezia, and a sense of urgency to defecate.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with Professor Mihiraa, who led a research investigation examining the effects of aspirin. You now have 90 seconds to read questions 31 to 36.
Good morning, Mihiraa. Thank you for joining me today to discuss the recent study conducted at Mihiraa Education Lab regarding the impact of aspirin. Can you start by providing an overview of the study and its objectives?
Absolutely, Professor O'Connor. What we set out to unravel in our study was the intricate dance between aspirin and cognitive function within a diverse cohort. We meticulously crafted an expansive experiment, delving into the intricate realms of how aspirin might sway the delicate ballet of cognitive performance. Our scrutiny encompassed a panorama of variables, gracefully pirouetting through considerations of age, gender, and the nuanced tapestry of existing health conditions.
All right, Mihiraa. Let's dive into our Q&A.
Yes, sure.
Question 1 is based on the study design and participants. Mihiraa, can you elaborate on the study's design and the characteristics of the participants involved?
Absolutely. We conducted a randomized, double-blind placebo-controlled trial involving 500 participants ranging from 40 to 70 years old. They were selected from various demographics to ensure a representative sample. Participants were randomly assigned either aspirin or a placebo, and neither the participants nor the researchers knew who received what until the end of the study.
That's interesting, Mihiraa. I am curious to know about the cognitive assessments. What specific cognitive assessments were employed in the study, and Mihiraa, how did you measure the impact of aspirin on cognitive function?
We utilized a battery of cognitive tests, including memory assessments, attention tasks, and problem-solving exercises. These assessments were conducted at baseline and regularly throughout the study period. By comparing the performance of the aspirin group with the placebo group, we aimed to identify any significant differences in cognitive outcomes. Now it seems a bit complicated for you to sort it out. You must have done it for some duration and on a certain dosage. How long did the study last, and what dosage of aspirin were the participants administered, Mihiraa?
Certainly, throughout a meticulously structured year-long study, participants were administered a carefully calibrated daily dosage of approximately 81 milligrams of aspirin. The selection of this specific dosage was not arbitrary. Rather, it was grounded in a thorough examination of prior research that hinted at the possibility of cognitive benefits manifesting at lower doses. Simultaneously, this dosage strategy aimed to strike a delicate balance, mitigating the potential risks and side effects that could accompany higher doses of aspirin. In essence, it represented a nuanced approach, leveraging existing knowledge to optimize both efficacy and safety within the confines of the study. That is impressive. Learning from the previous study and implementing outcomes for better results is calculative thinking. Then, the results and statistical analysis? What were the key findings of the study, Mihiraa? How did you analyze the data to draw conclusions?
Despite our thorough analysis, we discerned a lack of statistically significant disparities in cognitive performance between the groups administered aspirin and those given placebos. We employed sophisticated statistical methods, including t-tests and ANOVA, to ensure the robustness of our results. The lack of significant differences led us to conclude that, within the parameters of our study, aspirin did not demonstrate a noticeable impact on cognitive function.
Oh, is it? You must have done a subgroup analysis. Did you conduct any subgroup analysis, Mihiraa, to explore potential variations in the impact of aspirin based on demographic or health-related factors?
Yes, we did. We examined subgroups based on age, gender, and the presence of specific health conditions. However, the subgroup analyses also failed to reveal any significant differences in cognitive outcomes between the aspirin and placebo groups, suggesting a consistent lack of impact across diverse demographics.
That's a trouble. In light of these findings, what are the potential implications for public health and what avenues for future research do you envision in this area, Mihiraa?
While our study did not identify cognitive benefits from aspirin within our specified parameters, it's crucial to recognize the complexity of cognitive health. Further research could explore different dosages and treatment durations or investigate specific subpopulations that may respond differently. Additionally, understanding the long-term effects and potential risks associated with prolonged aspirin use will be valuable for informing public health recommendations.
Thank you, Mihiraa, for providing such detailed insights into the study. Your research contributes significantly to our understanding of aspirin's impact on cognitive function, and it opens avenues for future investigations in this important field.
Thank you, Professor O'Connor. It was my pleasure to discuss our findings, and I look forward to seeing how this research informs future developments in cognitive health studies.
Now, look at Extract 2. Extract 2, questions 37 to 42. You hear Professor Mihiraa talking on a scientist's journey through the COVID-19 pandemic, from witness to warrior. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. I stand before you today not as a professor, but as a scientist, a colleague, and most importantly, a fellow human who has lived through the unprecedented times of the COVID-19 pandemic. I am Dr. Mihiraa, and like many of you, I witnessed firsthand the devastation caused by this invisible enemy. But I also witnessed something extraordinary, the power of science and the unwavering dedication of those who fought tirelessly against it. My journey began with a sense of urgency, a desperate need to find a solution. I was part of a team of brilliant minds, all driven by a shared purpose, to create a vaccine that would protect lives and bring back a semblance of normalcy to our world. We were faced with countless challenges, working day and night, fueled by coffee and the hope that we could make a difference. There were terrifying moments that tested our resolve and pushed us to the brink of exhaustion. We saw patients struggling to breathe, families grappling with loss, and healthcare workers risking their own lives to save others. These are experiences that will forever be etched in my memory, a constant reminder of the stakes involved in our work. But amidst the darkness, there were also moments of incredible hope. Each breakthrough, each positive trial result, each recovery story fueled our determination. We saw the first vaccine doses being administered, the relief in people's eyes, and the gradual return of a sense of safety. It was a testament to the power of human ingenuity, a collaboration that transcended borders and brought together scientists, doctors, volunteers, and individuals from all walks of life. Today, as we stand on the other side of the pandemic, I am filled with an immense sense of gratitude. We achieved what many thought was impossible, the development and deployment of safe and effective vaccines in record time. Millions of lives were saved, and the world began to heal. But our work is not over. The scientific community continues to learn and adapt, working on new vaccines to combat emerging variants and protect the vulnerable. We also must address the inequities in vaccine access that still exist around the world. This experience has taught me more than just science. It has taught me about the resilience of the human spirit, the power of collaboration, and the importance of unwavering hope in the face of adversity. It has reminded me that even the smallest act of courage can make a difference and that together, we can overcome even the most daunting challenges. So, I stand before you today not only to celebrate the scientific breakthrough of the COVID-19 vaccine but also to honor the tireless efforts of everyone who played a part in this fight. To the healthcare workers who risked their lives, to the volunteers who participated in trials, to the researchers who worked day and night, and to the individuals who chose to get vaccinated, I say thank you. We have come a long way, but our journey is far from over. Let us continue to embrace science, collaborate with each other, and work towards a future where we are better prepared to face whatever challenges may lie ahead. We have the power to create a better tomorrow, and I believe that together, we will succeed. Thank you.
That is the end of Part C. You now have 2 minutes to check your answers.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.